the hill that I am willing to die on is sexual reproductive health is a life skill, period. Every component of sexual reproductive health can be applied to different aspects in our lives. And I think that is some way or another, we're able to market sexual reproductive health in a way that people understand that consent is not just about sexual experiences, right? Consent is, hey, can I borrow your pen? Yes, you may. No, you may not, right? And I think once people get a better understanding of it, they'll understand when I say things like start having conversations at 3. If your brother wants to borrow your toy and you don't want him to borrow your toy, we got to be able to have that and respect that boundary. And so yeah, it's so there are so many things, especially culturally, that I think of that I'm like, this was a missed opportunity.
Hey friends, welcome to Public Health Careers. I'm Omari Richins, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Daniella Thorne. Dr. Thorne is the Associate Director, Health Equity and Education at Advocates for Youth, and she is an adjunct professor at CUNY Graduate School of Public Health and Health Policy. She is a public health leader with over a decade of experience in health education, youth advocacy, and technical assistance, working across school districts, nonprofits, and community-based initiatives to advance adolescent sexual and reproductive health. She holds a Bachelor's of Science in Human Biology and a Master of Public Health in Health Policy and Management from SUNY Albany and a Doctor of Public Health in Community Health Behavior and Education from Georgia Southern University. In today's episode, you'll hear and learn more about why sexual reproductive health is a vital life skill, how consent is not just about sexual experiences, why Dr. Thorne emphasizes the importance of bodily autonomy from a young age, why sex ed should start as early as pre-K and must be culturally relevant and inclusive, and learn why she thinks she did not need her doctorate to do the work that she does now, and much, much more. Be sure to hit that subscribe button and leave a like. Enjoy.
Hey, this is Dr. Daniella Thorne. I am a sexual health enthusiast, and you are now listening to Public Health Careers.
Hey, Dr. Daniella Thorne. I'm so excited to have you on the show today and looking forward to learning more about your career path.
Yay, I'm so excited. Thanks for having me.
It truly, truly is my pleasure. And to jump into things, how do you identify and tell us a little about your personal background?
Yes, so I identify as she, her, hers. Personal background, there's so many things I could say. Descendants of Trinidad and Tobago, as well as Panama. Okay, period. Born and raised in Brooklyn, a Brooklyn native. I went to high school also in Brooklyn because, you got to say that sometimes when people like go to preschool and then whatever. I am a New York City girl. I live in the Catskills now. And at this point in my life, I enjoy working out. Never thought I would say that in a million years, but working out, hanging out with friends, good dinners, good libations, just having a good time when I am not working, spending time with my family.
Well, that's awesome. Well, thank you for sharing that. I was actually born in Brooklyn, so we got that connection as well as the Trinidad
I'm
roots.
telling you, we need to go get some doubles with some Cameron sauce.
I would love that. That's the one thing that I miss. Well, that and I think mangoes are the thing that I miss so much from Trinidad.
Yeah, for sure.
And you were sharing that you're into working out now, but that wasn't a thing for you. How did you get to this place?
What a big public health oxymoron. I was not the friend that worked out. I was never a student athlete. I remember in undergrad, being on working, literally living on the first floor that was walking distance from the cafeteria, walking distance from the gym, and walking past the gym every day to go get my food. Just never was an athlete. And COVID really is what started it. But prior to COVID, I would take these really ridiculous cycling classes, which was great, but definitely wasn't losing weight and wasn't eating healthy. And when I was around 30, I actually ended up being hypertensive. So as I was completing my doctoral program, I got diagnosed with hypertension, and heart attacks, strokes, hypertension have certainly ran in my family. And so when they put me on medicine at 30, and I was like, dang, this can't be my life story. Still wasn't enough of an impetus to start working out. COVID happened, and I became a remote employee. And I was like, if I do not intentionally move my body, I will live the most sedentary lifestyle ever. And so it started with just like taking walks outside just to get some fresh air. And then I took a HIT class, October of 20, probably 21, I think it was, or maybe 2020. I don't remember. That the last 5 years were a blur. But took one HIT class, high intensity interval training class, and I was like, oh wait, I'm kind of into this. This is in New York City, and then I found a gym that was closer to me that offered them, and I've just been going ever since. Like, and now I'm at the point where if I go 2-3 days, I just don't feel well, and then when my body started changing, oh, it was game over. When I started to see my abs still haven't really fought back for real, but I can just feel the energy that I have. My blood pressure is way better. I'm like, okay, this is something that like I need to do. Yeah, there's some vanity parts of it, but as I mentioned, I do have a family history of a lot of chronic illnesses. I am a Black woman, and so some things you can't fight against. You can't fight against genetics, but you can make good, healthy decisions. So that's how I got into it. And now shall I be boxing? I mean, I am like Pilates has been my thing. And the Pilates studio is a boutique studio right across the street from my house. So there's also no excuse. It's very accessible to me. So that was kind of COVID is why I started working out and been doing it ever since.
Yeah, well, I appreciate you sharing your journey into working out, and you definitely seem very enthused and to the point I think of like building the lifestyle and finding your why to do it. And I feel like especially in this social media age, there's so much around like the aesthetics of working out. But even for me, it's like when I don't work out, then I feel like less energy, and I feel like I get like more grumpy and things like that. So I think it's just like a leveling for myself.
Yeah, I go to the gym looking crazy. Like I'm like the girls that get cute to go to the gym. Okay, babe. Like I am, and it is an aesthetic thing. Like yeah, sure, close your Apple Watch, right? Like do all the things, but it also is heart health. And so although yeah, you might catch that in my story here and there, I don't post every time I work out because it's at least 4 to 5 times a week, and it's great. Yeah. You got to figure out the thing that you like to do. That's the key. Find the working out that you like to do, even if it's just walking outside.
That's so true. Like to your point, like you don't even like finding the HIT class and finding like that's the thing for you, and then I guess rolling into the boxing, Pilates, all the other things, because there's so many ways to be active, and I think we need to be expansive and open to that.
Yes, agreed. Because if you put me on a treadmill after 2 minutes and 32 seconds, I'm like, all right, it's time to get. But I could do a 45-minute HIT class without question, So you got to find your thing, and sometimes that takes some time, and it can be discouraging.
Yeah. So as you shared in the beginning, you're a sexual health enthusiast. What drew you into sexual and reproductive health education, and what continues to motivate you today?
Yeah, I would say, there's so many different things. My mother was always, I'm the eldest of 3 girls. And so there was always a conversation around, and perhaps you can resonate with this as also a fellow Caribbean, like, don't bring no babies here. Don't have sex. If you have sex, use a condom. That was like my sex ed at home. And she was so direct about it. And it was a little off-putting to me because I was young. I remember when I first got my menstrual cycle, that was a conversation. And I was like, what? I don't even know how to put this thing in my panties for real. And you're talking about babies. And so conversations around sex and sexuality happened very early for me, maybe like 10, 11, which is now I would say that's late, but it happened early in my home. And then it was just really curiosity for me. And as I navigated college, I really got to see how many of us went into this 4-year bubble with no information, right? And coming out of college and learning about the field of public health, I was like, wow, I really was drawn to pregnancy prevention, teen pregnancy prevention specifically. My childhood best friend at the time got pregnant when she was, I think, like 15, 16, and I was a little bit younger than her, and I just kind of saw her navigate pregnancy. And I just was fascinated by it. And so I was interested in teen pregnancy prevention and did some volunteer work and assistantships in undergrad and grad school, and then fell into teaching young women. So I don't know that I knew that the field of sex ed was even a thing, and I'll share a little bit more about that later. But it was just curiosity, and then like, how do we prevent teen pregnancy, right? What does that look like? And education was always just naturally where my brain went to. Mhm.
Those messages definitely do resonate with me coming from the Caribbean as well. So I agree with that. And you made a comment saying that you learned about sex ed to some extent when you were 10, 11 from like your parents, and you
Mhm.
shared that like that might be too late. Talk
Mhm.
about that.
Yes. Okay. Ooh, let's get into it. There was, you know what? It's funny. That's actually not a full true story, because my mom was really good at like, as the oldest girl, my mom was really good about like body autonomy. If someone touched you here, what are you gonna do? You're just gonna cry? What if someone says they have a lollipop or some candy, but if they give you the candy, like she would do these scenarios, these role plays, and it was very jarring to me, right? But now adult me is like, this was bodily autonomy, this was consent, this was who are my trusted adults, all the lessons that I try to talk to my 4-year-old nephew about, right? What is your comfort circle? What does it mean privacy? Your private parts, who are allowed to touch them, who are allowed to help you clean them. And I think oftentimes when people think about sex ed and they think about sexual reproductive health education, they don't look at it as a life skill, and they also don't think about consent or bodily autonomy as something that can start as two, right? When we are forcing our 3-year-olds and our 4-year-olds to kiss Uncle so and
Mm-hmm,
so,
mm-hmm,
and if they don't want to kiss Uncle so and so, we have to be okay with that. That's
mm-hmm,
not disrespectful. That's teaching that child, if it is something, as long as you're not being disrespectful, if it is something that you don't feel comfortable doing, you don't do, right? And so that's when I say, as far as talking about sex and like sexual intercourse, 10 and 11 felt early, but bodily autonomy is something that we should be teaching our young children from the moment. I'm talking about, this is your penis. This is not your PP. This is not your tool. This is not, it's the vagina. It's the vulva, right? It's not your cookie. So worst case, it is sexual violence prevention, because if someone is harming that young person, they now have the language for the body parts to be able to communicate it with their trusted adult, whether that's a caregiver, a grandparent, etc. And so, you know, it can start as early as 2, 3, as long as it's age and stage appropriate. You wouldn't be having a conversation with a 4-year-old about the different types of latex condoms that exist. That's not reality, right? But we will be having conversations around boundaries and bodily autonomy.
I appreciate you lifting that up, and I think that is an important conversation to have. And I think with guests that I've had in the past that have spoken about this, they've spoken to the fact that it's about having being able to communicate and having like healthy conversations
Mm-hmm.
at an early age. And like to your point, I feel like it's changing a little bit now with like, oh, go hug that person or go kiss that person, and like more nowadays people are more wary of those kinds of things. But I think it's so important for youth and everyone to understand like that bodily autonomy part of things. And like, because and I think about this a lot nowadays. I feel like more so nowadays in just how the things that we are taught and how we operate in life from an early stage really can dictate how things happen to us later on, or how we like perceive those things happening. And this is like one of the best preventative methods or education approaches for people to just kind of understand more about themselves physically,
Mm-hmm.
and how to, I guess, respectfully show up. I don't know if that's the like correct phrasing, but yeah.
How to be a good global citizen, right? Period. Like how to be a good global citizen. If you're on the train and there are all these seats made available to you, and you come sit next to me, like, you are violating my bodily autonomy. Like, and that's why the hill that I am willing to die on is sexual reproductive health is a life skill. Period. Every component of sexual reproductive health can be applied to different aspects in our lives, and I think that is some way or another we're able to market sexual reproductive health in a way that people understand that consent is not just about sexual experiences, right? Consent is, hey, can I borrow your pen? Yes, you may. No, you may not, right? And I think once people get a better understanding of it, they'll understand when I say things like, start having conversations at 3. If your brother wants to borrow your toy and you don't want him to borrow your toy, we got to be able to have that and respect that boundary. And so, yeah, it's so, there are so many things, especially culturally, that I think of that I'm like, this was a missed opportunity, right? And so when I am talking to my nephews or having conversations, I try my best to instill in them values that weren't instilled in me, and not because of anyone's fault. I don't think people had the tools, right? The language that now I have, especially being in this work for so long.
What does effective, equitable sex education look like in today's school systems?
Well, in today's school system, honey, like 2025? Oh, geez. In an ideal world, in a utopia, right, all identities would feel welcome. It will be a space where there is no dumb question. Questions are answered. Information is age and stage appropriate as well as culturally relevant. And when I say culturally relevant, the content reflects the populations in which it is serving. And oftentimes in sex ed, we don't see that. Um, the information would be inclusive of a variety of topics, and it would be sequential. And so it would start as young as pre-K and work all the way up to 12. Unfortunately, in most places in the United States, you might get puberty education where unfortunately they're still separating the boys and the girls, highly problematic, right? Because then you create a world in which boys are not comfortable talking to girls about bodies, right? So that young man may not be comfortable talking to his mom about his body. Where does that non-binary child go? It's just so problematic for a lot of different reasons. But young people may get one lesson in 5th grade about periods and nocturnal emissions, and then they may get maybe get a class in middle school, and then by 9th grade we give them 6 weeks to learn everything about their bodies, and then that's it. And then we send them off to college and hope that they have all the tools. In an ideal world, sex ed would start at pre-K and go straight through 12. And we would continue to reiterate those messages if people choose to go to, a 4-year college or any type of post-high school, whether that's you go to an institution or not, you have access, even if it's community sex ed, where you can get questions answered. You would be surprised how many young people that I taught in high school still slide in my DMs asking for clarifications about something about their body. And in my head, I'm like, you haven't seen a gyno at this big age, but perhaps you still don't feel comfortable talking to, your gynecologist about this challenge that you're having with your body or questions that you have. And so it should be continual across the lifespan. All identities should feel welcome and accepted. And it is something that literally, there's like so many topics that I can think of that can be included, but those are the main things. They should be evidence informed and culturally relevant to the community that it's serving.
I love that. Sex ed should be a life skill, or should be viewed as a life skill and leveraged in that way.
It should. Even if a person chooses to never have sex in their entire life, it's still information that they should know.
You touched on this a bit around the culturally relevant, settings, or having programs and information that's culturally relevant. Mm-hmm. How does one ensure that culturally relevant and developmentally appropriate content is created for diverse school settings?
Yeah, such a great question. That's really why I got into this work and what excited me about this work. So I think firstly, in a lot of the curricula, like a lot of states, specifically counties, because in many places there aren't really requirements at the state. It'll be like, teach health. And then at the county level, they have more specific things. A lot of counties in this country will have clauses that say that there should be a committee that has parents, teachers, and young people that review curriculum on a biannual basis or whatever the basis is to make sure that it's good. And I think that the easiest way to make sure that something is culturally relevant is to have youth voice incorporated. Our young people should be reviewing the lessons and providing feedback to school districts, superintendents, etc., to update curricula to make sure that it still works, right? Some of the curricula that's being used is old, respectfully. Right? It's old, it's antiquated. The videos are from 1992 where people's cell phones are as big as this book, right? And so young people are looking at these videos that perhaps have really relevant information, laughing at the baggy jeans that the person has on, right? And so I think if we can have young people have a seat at the table, not for tokenism, but really to share their feedback so that curricula reflects the population, right? And I know that can be challenging, but sometimes it could be a simple fix of changing the names and scenarios, right? So maybe you can't go through, maybe the school district doesn't have the capacity to go through and change every single lesson, but relevant scenarios. I know where I went to high school, there were certain names that did not Jake, you know, like, okay, that may not work for everybody, right? But if the scenario says Tyrone and Tamara, wow, that feels a little bit more relevant, perhaps, for the people that I'm serving. Or, you know, maybe there's a non-binary, maybe we're using pronouns like they, them in our scenarios. And so I just think there's such an opportunity, and sometimes I think school districts think it's an arduous task, like it's really going to be hard for them to make this thorough edit. But have young people help, pay them. And I think you'd be surprised how much input they have, because there are things that us as adults, we just don't get, right? Like, and also including them in the activities. Hey, create a TikTok. You know, the girls love TikTok. Create a TikTok teaching people X. You'd be surprised at the amazing work that they can come up with. So I think one way for sure is getting young people to the table.
I fully agree with that. I think we need to continually make space for young people, their ideas, and giving them space to be messy in creating those ideas and solutions. And like, to your point, I don't even know what the words are that the young people are using these days. So like having that input from somebody that's in that community that could really like make a message resonate just that much more could really increase like the effectiveness or efficacy of some of this work that's going on.
Absolutely. Yeah.
And how do you center youth voice and lived experience in your work?
Well, in my work now, you know, the organization that I work for is a youth-focused organization, and it has really shown me just the beauty of youth voice, centering youth voices, centering marginalized populations, bringing them to the center, amplifying their concerns. You know, it's taught me what does youth advocacy look like, because young people are the experts of their experiences, right? And us as adults, oftentimes we like to, you need to, and it's like, maybe that's not the approach, friends. And so naturally I do that through the organization that I work for, but in my own personal work, I think I learned how to do it as an educator. As an educator at a school that was predominantly Black and brown girls. I mean, like truly like 97% were Black and brown girls. I was very young at the time. I was fresh out of my master's program, so I might have been like 23, 24. So they saw me as like big cousin, but I was still Miss Thorne, like not too much, right? Like not too much. And working with them was probably one of my biggest life accomplishments, because I was able to create the same things that I'm talking about. And so for me, it was like, okay, I need to talk about interpersonal and relational violence with these young people. We're going to watch Eve's Love is Blind video. We're going to dissect it. We're going to dissect the lyrics. We're going to talk about what do we think is healthy, what's unhealthy. We're going to talk about why. We're going to talk about scenarios. And I was able to create lessons for those young people that I wanted in high school, right? That, you know, at 18-year-old me, when I thought I was in love with I had met the love of my life, my high school sweetheart was my end all, be all. What information would I have loved to know at that time? And getting feedback from them and like learning with them. I think that was the coolest part for me, because it was my first time teaching. I got to learn with them and create with them. And that was where I saw the beauty of just really culturally relevant experiences, where it wasn't just this textbook health class. It was a health experience, and they were able to really learn about their bodies, their sexual reproductive health anatomy in a way that they had never learned about it before. And I clearly did too good of a job creating spaces, because when I tell you they still slide in my DMs, and these are grown women at this point. They are in their 20s now. But that is one of the ways that I learned, kind of through trial and error as an educator. Yeah.
Yeah, that's very meaningful,
Hmm.
and I'm glad that you're still a resource for them to lean on as well.
I think I'm glad. I don't know.
Pros and cons, pros and cons.
Exactly.
uh, so before we shift across to some of your academic pathway, I would love to ask, what does public health mean to you?
Public health is everywhere. Public health is caring about the health of others other than yourself. It is, how does every action that you do impact the health and wellness of everyone else, right? Everything to leaving the water on while you're brushing your teeth, even though you're not using the water. Recycling, when you are, sitting in the car with your car running because it's hot outside and AC is just the emission that's coming from your car, right? Public health is really just caring about others in a way that's meaningful, and it's everywhere. It's so everywhere, and it's so funny. I will tell you, when I was pursuing a master's in public health, I started my master's program in 2010. No one knew what the field of public health was. I struggled to explain it, and I still struggle to explain it now. But I think because of COVID, people are like, "Oh, public health, yeah, we need those people, right?" Public health is everywhere, and it's so broad, and there's so much opportunity in the field, which could be a good and a bad thing when thinking about career paths. So I do think it's amazing that you're doing this type of avenue for folks, because the opportunities are endless, which is good and challenging. But that's what it is to me.
I appreciate that. And yeah, I always say that it's like the first step is like learning what public health is. And then when you learn that there's just like this field that you could work in public health, then it's like, oh, there's so many ways. And the second question is what and where do I want to be in public health? And that is a very tough question
Hmm.
to ask.
Hmm.
But it does have an answer. It does have an answer. Um, so for yourself, you got your Bachelor's of Science in Human Biology at SUNY Albany.
Hmm.
What was that thought process going into undergrad?
Well, initially I wanted to be a physician assistant. That was my intention, was to be a physician assistant. And I volunteered at a hospital, and I was like, this ain't it. This is not the vibe for me. Um, and so then it was like, okay, well, I knew science was my thing, and Caribbean parents, my mom was very clear about, I had certain majors that I was allowed to choose when I went to school, and there was just more grant programming for science majors, especially as a Black student. And so I just stuck with human biology. And so at the time when I knew I wasn't going to do physician assistance or go into clinical medicine, I had to determine what field. And I found out about public health, I think my junior year of school. And so I ended up going to doing an intro to public health class, and I was like, oh, yep, this is it. This is it. But the human bio thing was like, I was not pre med. I never necessarily wanted to go to med school, but pre public health, physician assistant. And I just kept going with it.
Yep. Definitely Caribbean parents. I think there is a lot of value in that, especially considering the world that we live in today. But regardless of that, I think it's important to highlight just like it's always great to have like that vision that keeps you going forward. So you're thinking, okay, I want to be a physician assistant, and then you test out some things, and you're like, no, I don't really want to be a physician assistant, but what else can I do that's related to this? And thankfully for you, you're able to take that intro to public health class as well.
Yeah.
Um, were there any big takeaways from your undergrad?
Hmm. I think the biggest thing was like I did a lot of internships. I did like a summer research program. I took advantage of every single, maybe not every single, but a lot of the opportunities that were made available to me. I was a part of an enrichment program called the Collegiate Science and Technology Entry Program. I'm not really sure if it still exists, CSTEP. And so that was for undergraduate students who were interested in allied sciences or any type of like licensure career. And so through that, I was able to do research programs, different internships. I interned at like the assembly for one semester. And so I took advantage of that, which helped me really understand the career path that I was interested in. Although I didn't go, I mean, it's so not fair that we expect people at 18 years old, if you go into college traditionally, to know what they want to do with the rest of their lives. Because what? And so I just kind of did everything. There still was like a streamline in like health, right? Health and wellness and science. But that was a great way for me to get clearer on either the things that I liked or didn't like. And that was important for me. Mm-hmm.
Yeah, having humans choose to go to school at 18 and make those big decisions is we're as a society. It is weird that we as a society have like made that like more of a norm than not. But we live in this society. Okay, so you were in that process of like learning more about yourself and what you wanted to do.
Mm-hmm.
When in that process did you know that you wanted to pursue a master's of public health? And just for the audience, you got your master's of public health and health policy and management at SUNY Albany.
Yes. So I was a EOP student at SUNY Albany, which essentially means my tuition was paid for through grant funding. And then I got, as I said, as a science major, as a Black woman who was an EOP student, there were other grants that I was able to get. And so because I was an EOP student, my master's program, the tuition would be paid for. So I knew I was going to go straight into a master's program from undergrad because I had no other plans. Because again, 21, supposed to know what I want to do for the rest of my life. And I did the intro to public health class, either my junior or senior year, and I knew like, okay, I'm going to go into the field of public health. In hindsight, I should have did a community education concentration when I got my master's. I did not do that because everyone was like, they make the lowest amount of money. It was a money thing. It was a money game. It was like, I need to make money when I graduate. And I allowed others to influence me and say that policy and management was the best direction to go because I can go into hospital administration or just healthcare administration. And that's where the money was. So it was less of a passion thing and more like, okay, I've been in school since I was 3. How do I finish this degree in 2 years and start making some money? Yeah, that's my truth.
And I appreciate that. And like maybe like to someone that is thinking about a master's program, how would you advise them to kind of like balance that thinking about money versus thinking about like what you actually really, really want to do?
Oh, this is such a good question because I feel the same way about my doctorate program, and I don't want to skip too far ahead. But I think careers like a master's of public health or a master's of social work, I don't think there's no wrong in getting any of those degrees because you can apply it to so many different sectors in life. Even if you get an MSW and you choose never to do clinical therapy, you can use it in other avenues, right? There are people that I work with in this field who have social work degrees. So as it pertains to a master's in public health, I would still say get the master's in public health, even if you're not sure what you want to focus on, pick something because you can use a degree in so many different fields, right? And the good thing about the MPH, at least with my program, I think that first year was focused on taking classes across all the concentrations. So your environmental health, your policy, your biostats. Ooh, biostats ate me up, honey. Knew I wasn't going to go into that. Epidemiology, community health and education. So take those classes and hopefully, after your first semester or second semester, then you're able to glean which one you would want to focus in. But I don't think you can go wrong getting an MPH, Master's of Social Work. Those are the only two that I can think of off the top of my head that can be used in a variety of careers.
Yeah, I would agree with that, and I feel like the MPH is like one of the few like graduate programs where you kind of like specialize but don't really specialize because you're still learning so much about public health since it's so broad. And did you have any other takeaways from your MPH program that you wanted to share?
No, because I went straight, to me, it was just like year 5 and 6 of my undergrad. I don't really, I really don't remember that. Unfortunately, I really don't remember that experience. Now, my doctorate, I could talk to you from here to kingdom come about that. But yeah, no, not really. It serves its purpose. That's what I would say.
Okay. And before we get to your doctorate, I believe all of these roles you held prior to your doctorate. I'm going to name them out, and then you can talk about them as much or as
Oh
little as
boy.
you'd like.
Okay. Go for it.
So you're a graduate assistant for Science and Technology Entry Program. You were a health educator at Albany Leadership Charter High School for Girls. You were an intern for the New York State Department of Health, and you were a researcher for the Center for Elimination of Minority Health Disparities.
Mm-hmm. Okay. Yes. All those things, right? Okay. So what I will say is the graduate assistantship for the Science and Technology Entry Program, that was like a middle school and high school version of the program I previously mentioned, the Collegiate Science and Technology Entry Program. So same thought. It was like enrichment classes for middle school and high school students. They would come to the SUNY Albany campus on Saturday mornings. And so, we would help them tour the campus. We would do panel discussions. It's really to just have middle school and high school students of color see the different career paths and just the college experience and learn more about different careers. And then we also like help them with their homework. So it's kind of, think like mentorship program. So I was a graduate assistant for that, their Saturday program. And then the Center for Elimination of Minority Health Disparities, that was something I did. I think you had to do like a preceptorship of sorts with the master's program. Most MPH programs require that. And so that was fun. So that was working with a Latinx population of teen parents, pregnant and parenting teens who were Latinx, and we would do different workshops for them, whether that be job readiness, lactation classes. So that was my real first introduction to community engagement, boots on the ground. And I just was there like as support to the program. It was a grant funded, I think it was an NIH funded program. Wilma Alvarado Little was the director of that. She's a powerhouse in the Capital District. And I just kind of was under her tutelage, just learning from her and like doing the things like, okay, yep, I'll get the newsprint and the markers for the event. But I was really able to see what community engagement looked like doing that work. And that was all through my master's program. The Albany Leadership Charter High School for Girls is the high school that I mentioned. And so as I was completing my master's program, that high school had came to visit the campus. And because I was working as a graduate assistant for STEP, I was one of the people that helped them do the tour. And their social worker at the time was like, hey, what's your undergrad in? I'm like, human bio. She's like, great. We need a bio sub. And I'm like, I'm like, okay. And so I ended up, because I think their bio teacher at the time was on like maternity leave or preparing to go on maternity leave. And so then I started teaching a few periods, a day for one of their like their bio classes. And once I completed my master's, I like pitched myself to the principal and the admin to see if I can teach health. And the great thing about charter schools is that you don't necessarily need a teaching degree to teach, which can be problematic, right, in theory. But the principal was like, okay, like you have a master's of public health, like this feels appropriate, right? It wasn't like I was asking to teach Spanish. And so she believed in me. She gave me that autonomy, and that's how I got into teaching health and women's public health issues. So it really created a world where I was able to coalesce my interest in community engagement, education, and like culturally relevant intervention and experiences for young people. And like those 2 years literally changed my life.
Yeah. What did it change about your life?
Oh, great question. It really just helped me see where the chasm is in education, because at the time I wasn't the only health teacher. And so there was another person, won't say what their racial ethnicity was, but the girls that was in that class was like, how do we get in your class? Right? Like, we heard what y'all are talking about. We heard about the different activities that you're doing. I need to be in that class. And I had moments where I was able to sit in that other teacher's class, and not that she was doing a terrible job, but it was just it didn't hit. As the young people would say, it didn't hit, right? And so I really got to see the chasm. She was teaching from the textbook, which is like, yeah, that's what textbooks are for. But girl, give us a little bit of color to the black and white, right? And I also got to see, as I mentioned, the school was predominantly Black girls. It was an all-girls school, and most of the educators were white women. However, the admin were all Black. And I also got to see really the challenge in the school system, right? In teachers or educators like really just not being bought into the work that it takes to get these girls up to reading level, up to the standards that they need to be at, and the investment. I think that as a Black woman in this space serving Black girls, there was a different level of investment for them to win. And I don't think that people of other racial ethnicities weren't as invested. I just think it was more personal to me. So when I saw that first graduating class walk across the stage, you would have thought I birthed those children from my loins, right? Because it was like, yes, yes, you can do this. You know, yes, you can break these generational repetitions of certain experiences that you don't want for yourself. And so that's why I say it was life changing. On top of, it's really the reason why my career path went in the way that it did as it pertains to pursuing my doctorate.
Well, we were just about to get into that.
Okay, let's
go. So you got your Doctor of Public Health in Community Health Behavior and Education at Georgia Southern University. Mm-hmm. What led you to pursuing DrPH?
Yes, so I want to start by saying my mom is a retired New York City educator, and I promised myself I would never be a teacher, which is a joke. You tell God your plans and he laughs at you. Towards the second year of teaching, I was just like, yeah, this is not my life's calling. Like, I don't want to do this every day. And I wanted to be kind of similarly to what I was just mentioning. I wanted to be a part of making curricula on a national scale that was for us, by us, you know? And what I know now is that I didn't have to get a doctorate to do that. I didn't know that then. So I was like, you know what? I'm going to get a doctorate. Like, I'm going to get a doctorate. I'm going to pause my life for 3+ years and pursue this doctorate. I had applied to a school I applied to 2 schools. I applied to school in Brooklyn, SUNY Downstate, and I applied to Georgia Southern University. SUNY Downstate was like, hey, cool story, but we want you to retake your GRE. And at that point, you have 5 years. At the time, you had 5 years to use your GRE. And so I was on the 5th year. 2014 was the 5th year. Was not trying to retake that test. And then I applied to Georgia Southern. I never visited the school. I never talked to any professor. It was in Statesboro, Georgia. They were like, come on down. And I was like, oh, wait, LOL. Like, you know, like, wait a minute. And then I didn't know if I had an assistantship, because then it's like, how am I paying for this? I got an assistantship that paid for my tuition. So I knew I was going to still have to take out loans for like just living, right? Like rent, food, etc. And I drove down to Georgia just like on a will and a prayer. It was so like, when I tell people, when I recount it now, it sounds extremely nonsensical. It sounds very risky, but I wanted to be able to influence health education curricula on a national scale for Black and Brown people, and that's why I got my doctorate.
And how did the doctorate help you in achieving that goal or realizing that goal?
To be honest with you, it hasn't. It hasn't. And I, you know, it's funny because when you invited me to do this, I was like, I am probably going to say probably one of the most controversial things that you've ever heard on this podcast. I did not need my doctorate to do the work that I do now. And I think it's important to name that, because if I knew that the work that I do now existed, I wouldn't have gotten my doctorate. I would have just tried to get into the organizations that do this type of sexual reproductive health education, technical assistance. I didn't even know what technical assistance meant, work. Did it overall help me? Sure, because my dissertation was on adolescent perspectives of comprehensive sex ed in Georgia schools. And so I was able to, like I said, get young people to the table, right? I was able to do focus groups with young people about what they were getting or not getting in their Georgia schools. At the time, Georgia was abstinence only. I did focus groups in Savannah, Georgia, and right before they were about to adopt a more comprehensive curricula, which was like, thank God, because then throw the whole results away, right? And so just learning how to interface and center use voices was something that my dissertation process taught me. I think from a professional standpoint, you know, I learned how to work with people of all age ranges and people who also had families and spouses, and children and just navigating it together. I would be dishonest if I was to say like the coursework didn't help me, like program evaluation, right? How do you figure out your program goals, objectives, your SMART goals? You know, as a public health professional, we love a SMART goal. That definitely helps me now when I'm supporting grant writing for large amounts of money to support my projects in my work now. But again, I think, you know, the 3.5 years that I spent pursuing the degree and the student loans that I acquired with the degree, I think that I could have gotten that in a professional setting as well. And so when people come to me and they're like, I want to get my doctorate, and I'm like, why? Why? If you don't want to be a professor, if you do not want to go into academia, you do not need a doctorate. Not in this field, in my personal opinion. That might be a hot take. In my personal opinion, you don't need a doctorate. And I encourage people to really talk to the people who either have the doctorates in the things that they're interested in, have done the research in the things that they're interested in, and or the organizations that are doing similar work, because I would hate for someone to take their time, because getting a tertiary degree is literally the most taxing thing. I mean, I'm not a parent, so perhaps parenting and it may add to that, but like emotionally, financially, physically, it's very taxing. And so I would encourage anyone to think about the investment.
Well, I appreciate your candid and honest insights there. I think that is very much appreciated, and like it's one of the reasons that I have not pursued a doctorate myself. It's like I don't know if it will give me the actual like benefits, or I don't think it's like 100% necessary for where I am right now.
Mm-hmm.
And I think, like, to your point, it is so important to have that perspective of like what you want to do, so then you could kind of understand maybe what are some of the organizations and jobs that I want to work at, and start reaching out to those people
Mm-hmm.
to find out like, hey, this is what I want to do, this is what I'm thinking, is it even necessary for me to do a DrPH or a PhD, and what's your experience with
Mm-hmm.
getting it? I think those are very, very important questions, and definitely not jumping into a doctorate is I think the better way to go about things, especially if you're like career oriented, as you said,
I agree.
because
And I
there
did
might
none
be
of
other
that.
ways.
Yeah, I did none of that. I'm telling you what I didn't do, so to encourage someone else, like, right? Because I mean, yes, it is something that I have earned. No one can take it away from me, right? They could take these student loans though. These they could have these student loans back. And so I'm glad that I did it when I did, right? Because I had the wherewithal, I had the tenacity, and you know, again, going back to that Caribbean descendancy, I'm not no quitter now. So I'm gonna finish this thing on and off. But yeah, I wish I would have reached out to people, but I also didn't even know that the field even existed in the way that it did, because like as I mentioned to you, I was interested in pregnancy prevention. I didn't really get into sexual reproductive health until post my doctorate. Whereas when I was teaching the young girls in the high school, it was like health education, and I had the most fun when we did reproductive sexual anatomy and consent and healthy relationships, but didn't have the language. And that was me not doing my own due diligence. Mm-hmm.
Yeah, absolutely. And definitely, I think it also goes to show, like, even though you're saying like that wasn't the ideal maybe choice for you at that point in time, it has led you and given you opportunities and skill sets. And
Mm-hmm.
even for myself, like, while I said what I said like 2 minutes ago, like I understand that it could be a lot easier for me to navigate whatever field it is I'm in with that terminal public health degree.
Yeah.
Were there any other takeaways from your doctorate program that you wanted to share?
Mm. Yeah, I think the other thing that I would say is I got a DRPH because I knew I wasn't interested in being a researcher post graduation. And I think one of the things that people oftentimes don't talk about either is the postdoctorate job market. As I mentioned to you before, I was in school from 3 years old till the ending of my master's, and then I taught at the school. And although like you listed all the things that I did while I was getting my master's, I'm like, not me sounding like I was just I'm one to have 50, 11 jobs for sure, but I was intentional about that, just because I always like to see the different things that I'm interested in. And then I worked the 2 years at the school, which most DrPH programs want you to have some level of work experience. Did the program for the 3.5 years in Georgia. And then when I started applying to jobs, those jobs did not give a good doggone that I had a doctorate. They wanted their 10 years of experience. They wanted whatever the years of work experience were for these director level jobs that I was applying for. And it was really, really hard for me because there were so many people who were so excited. Everybody had their pom poms out like Dr. Thorne. And I'm like, Dr. Thorne can't find a job. Can I just be vanilla? Like I could not find a job because I didn't have the work experience. And so that's something that I would, one of the takeaways was like, wow, some people do the programs while working, so they'll do it part-time and, it takes a little bit longer. Trying to figure out ways to continue to get work experience while in a program, which can be challenging because it is hard. It's hard to kind of balance completing the program in, 3 years, 4 years, and trying to also work, but also thinking about what work experience looks like because all the jobs that would even consider me were master level master level jobs. And unless you're going into research or like federal jobs or maybe teaching, very few jobs require you to have a PhD. So yeah, that was hard. That was a takeaway for me. And anyone who is listening that's considering a doctorate, I would encourage you to think about applicable work experience that you have and what do you anticipate? How are you going to market yourself if you choose to do it full time post this degree? Because it all sounds good, right? That you have this degree, but at the end of the day, they don't care that you wrote the paper and you got an A in your evaluation class. Like, how many actual programs have you evaluated? So yeah, that's another takeaway I have.
Well, those are some good insights for those people out there that may be thinking about considering a doctorate program. So I appreciate you sharing that. Mm-hmm. I believe the first job that you had after your doctorate was as a program manager at the Georgia Campaign for Adolescent Power and Potential.
Yes.
Okay, so I'm right. So tell us about getting that role, and then how did that shape your work in advancing sex education across Georgia?
Yeah, so how did I get that job? So as I mentioned, my dissertation was Adolescent Perspectives of Conference of Sex Ed in Georgia Schools. At the time, I was living in Savannah and Chatham County in Georgia and was working with their health education coordinator to recruit young people to do my focus groups. And as a result, they also had their committee that was in the process of updating the sex ed curricula. And so I sat on that committee as like content expert, but just also trying to get I want to tell everybody. Because I'm going to need a job in about 6 months. And so volunteering my time. At the time, I think I also was doing like sex ed in the community-based setting. And the director of the Working to Institutionalize Sex Ed program had came to Savannah to do a presentation on the sex ed curricula that GCAP was offering. GCAP at the time had grant funding to provide sex education curricula, training, technical assistance to counties throughout the state if they adopted a comprehensive sex ed curricula. I was like, this is my life's work, right? And so they do their presentation, and I'm like into it. And after I went and talked to him, I was like, hey, I'm a graduate student here at Georgia Southern University. This is what my dissertation is on. Really, really love your work. I'm here. I'm, finishing up. Would love to stay in contact. And what ended up happening was Savannah decided to adopt a curriculum, one of their curricula. But the organization was based in Atlanta. And so it's like it's over 3 hours to get from Atlanta to Savannah. And so they had brought me on as their like Savannah-based consultant to provide technical assistance to the Savannah teachers as they were adopting this very different curricula from their abstinence-focused curricula. This is a little bit more comprehensive. And so that's what I did. And then once I graduated, so I started doing that fall of 2017. I graduated December 2017. And then by that April, they had a full-time position open up, and then I ended up moving to Atlanta to do the program manager work for them full-time. And so what that looked like was not just having Savannah, but now I'm traveling with a director throughout the state to try to get different counties to adopt a more comprehensive sex ed curricula, which was fascinating because we were going to some of the smallest counties in the Southeast, where like the deacon is also the superintendent. We are trying to convince them that they need this LGBTQ plus sex ed curricula. But it really showed me, it introduced me to advocacy kind of haphazardly. But that's how I got into that role. So no one cared about my doctorate. I mean, so my doctorate did help, right? In the sense of like, my dissertation was very much so aligned with the mission of the Working to Institutionalize Sex Ed program. But I didn't need a doctorate for that job. And I remember having a conversation with one of the people in the executive board about the salary at the time, and saying like, well, you know, I got this doctorate now. And she was like, your doctorate is not required for you to do this job. And I was like, heard you. And I was like, oh, I can't wait to tell the masses, like, when y'all decide to get this degree, let's do some cost benefit analysis, right? Like, for real. So yeah, that's how I got that role.
Okay, that's awesome. And thank you for sharing that. And sorry that negotiation didn't go as well as you would have liked.
Pop, you know that show Pop the Balloon? She popped my bubble. Okay.
Yes. And then after this role, you moved into the organization that you currently work with, Advocates for Youth, and you were a senior program manager before your current role. So how'd you get that role, and then what do you do?
Oh my goodness, yeah. So stayed at GCAP for 3 years, right? 2017 to 2020. And at that point, I just was like, okay, I've reached my like cap in this organization. There really wasn't much room for growth. There was a director position that became available, applied for it. I was doing the role as the director for like 6 months as the person had transitioned. They brought somebody else from the outside, and I was like, oh, it's time for me to gather my things. I gotta get up out of here. And so this role became available. It was January 2020. And it was a perfect way for me to scale up my experience, because at GCAP, I was doing the work on a state level. The role at Advocates was to do it nationally. And so it was to support 28 federally funded school districts throughout the country with their sex ed. And I was like, this is the natural progression to do this work. When I look at my personal statement for grad school, it was to support national sex ed. Like, Jesus, please, okay, help your girl out. So I applied for the job, and after like a couple rounds of interviews, I got the job, and it required me to move to DC. April 20th of 2020, I was starting my role in DC. Early March, went to go look for apartments. I was in the process of like applying, COVID hit. And so I never made it to DC, never ended up having to move. You know, they were going to open the office and they weren't going to, you know, that whole, everybody knows how that went. And then they just decided ultimately to let programmatic staff remain remote. But what is most fascinating is that I was excited to scale up my experience with technical assistance, and really what technical assistance means and looks like is supporting educators in teaching sex ed. Most health educators, health teachers didn't get any sex ed work or any sex ed courses. They may have taken one sex ed course in undergrad, but really the instructional competencies that one should have in order to teach sex ed in a evidence-informed, trauma-informed, inclusive way, that takes skills, right? And unfortunately, health education, physical education is just not, they're not testing subjects in which a lot of funding is piped to in school districts. And so that role gave me the opportunity to see, one, the lack of funding throughout the country for this work. But as I said, these school districts were funded through the government at the time. And so to figure out how to train these educators virtually, as they were figuring out how to teach sex ed virtually. Could you imagine virtually sex ed? So we all were learning together. We were truly flying the plane as it was in motion. I mean, excuse me, building the plane as it was in motion. But it was great because it taught me really how to engage people. That it's easy to engage people when you're in front of them, but how do you engage them virtually, right? And so that was cool. That was really cool work at the time. Yeah.
And then you were able to get promoted to associate director, health equity and education. Tell us about that shift and like what it meant for your roles and responsibilities.
Yeah, so our funding ended up sunsetting with that particular federal grant. And there was an opportunity for my work to pivot to HIV prevention and advocacy, which was like really cool because it was very much so tangential to my work in sex ed, right? Because HIV prevention is naturally a part of sex education. But this was specific to Black women of cis and trans experience. And so what that work looked like was supporting a cohort of young people who are working against destigma of HIV, working against HIV decrim, as well as advocacy and awareness. There are so many facets of HIV prevention and access to care that oftentimes are not spoken about, and certainly not spoken about to Black women. And so that's been really fun and different for me because, like I said, my work has typically been supporting educators. And so now I'm supporting young youth activists, Black women activists. And additionally, I also was supporting federal funding that we had at the time that was around digital advocacy and creating HIV prevention or access content that was a little bit more inclusive. So Black women, LGBTQIA+, people that look non-binary on the digital media, outlets, and working with community partners. And so because my work kind of transitioned from laser focused to sex ed and a little bit more broad, we, changed my title a little bit to be more encompassing. I still do have the privilege of supporting updating sex ed lessons and still doing trainings because I like to keep as you can tell from like my list of things, I like to keep my hands in a couple different pots, right? But yeah, so my work now is a little bit more broader and not as laser focused, which is great. And like, that's what I say when it comes to the field of public health, like you have the leverage to do so many different things. And so I'm excited. I'm always excited to help support a project that is different from what I'm used to because then I get to learn more. Yeah.
And what were some of like your biggest insights? You said working at GCAP, you were working like statewide, then you're able to work in a senior program manager role where you're able to work nationally.
Mm-hmm.
And now as the associate director, it seems like the topic area kind of broadened nationally as well. So like what kind of like advice would you have to someone that's thinking about like scaling up their work in that way?
Yeah, it's a really good question. I would say really hone in on your transferable skills, right? If you're able to run a program successfully at the high school level, you probably can do it at the county level. You probably could do it at the statewide level. And so as you're in whatever role that you're in, how can we transfer those skills and scale them up? And so I needed to, and I think there's beauty in every journey, right? I think it was meant for me to get my doctorate and meet that man in that presentation and have the experience. And I looked at that job, although it was a very low paying job at the time, I looked at that job as a postdoc. I was like, this is my postdoc. I'm not giving this more than 2 to 3 years. I'm gonna get this experience, and then we're gonna have to get up out of here and gather our things. I think that so it's like figuring out what your transferable skills are, figuring out what scaling up looks like for you, and making the most out of every experience that you have. We are at a time in this country and in the field of public health, specifically if you're interested in sexual and reproductive health, where it is trying. There are a lot of my loved ones and colleagues who are struggling to find jobs, have been laid off. It is just like really hard. And so if you are privileged enough to have a job at this time, how do you make the most of that job? Maybe they're not going to pay you more money, but guess what? Go help them with that project and go help them set up that health fair. You make yourself integral to your organization and get as much experience as you can so that when the opportunity does present itself, because it always will, it just may not be at our time, when the opportunity presents itself for you to scale up, you now have additional tools that you can use in your next experience.
Absolutely agree with that.
Mm-hmm.
So, in your current role, what do you like most about the work and what is most challenging in your work?
Yeah, great question. I love the organization that I work for, and like literally, they're not sponsoring this, but it is the most. I feel like I'm able to be my most unapologetic self. I have worked at organizations where it was a little bit more conservative. We had to be mindful of what the donors thought. You kind of had to be zipped up. Um, and at this org, they are unapologetic in they're unapologetic in their advocacy in centering marginalized populations and young people. Period. Right? They're unapologetic in ensuring that young people have the right to access health services. They have the right to equitable sex education, and anything that is opposing that, we fight fiercely against. And that feels really good to me. It feels euphoric. It feels like I am working with an organization and for an organization that aligns with my own personal values. So that is the best part. I think the other part that I enjoy is that we are able to I'm able to cross collaborate. So I might work with the policy team on something. I might work with the development team on something. And so kind of like what I was saying is like getting other experiences that are in theory outside of my wheelhouse. But everyone is really passionate about their work, which makes me interested in supporting them, right? And so that's partially why we made my title now a little bit more general, because there's just so many different things that I kind of do in projects that I take on. So I love being able to do different things and get different experiences. What is the most challenging? I think the most challenging part of my work right now is the political climate. I am fearful for what the next couple of years look like because there's so much time left. And what the next couple of years look like. Some of the laws that are coming down the pike and that have already been instilled are directly harmful to the youth that I'm passionate about and serve. And so that makes it challenging to do my work because in thinking of the creative idea or in thinking about, oh, great, we got these, this new beautiful Black trans woman who has been thriving with HIV since birth or since whatever age, and she's excited to do advocacy work. And then the next day it's like, oh, HIV funding has been cut. And, and it is daunting. It is daunting. And so that is the hardest part of my job is continuing to stay motivated and excited and not feel like my wings are being clipped, and also trying to ensure that I don't show that sadness to the young people that I'm serving, because if I, as the adult, seem like I am sad or I'm feeling like despondent about what the future may look like, then most certainly they're going to feel that. So finding the silver lining, I guess. I don't know.
Yes, it's becoming hard these days, but we definitely have to continue to reach for it.
Yeah, for sure.
And then you've spoken a lot about like education being some of the passion that you've done, and you currently also work as an adjunct professor at CUNY SPH.
Mm-hmm.
You kind of spoke about like what you enjoy about teaching, but I wanted to ask, what insights do your students offer to you? What do you learn from them?
So I teach an online class, which is very different. It was just funny because as a student, I hated online classes. But I teach an online class, and it's really great to get perspective because a lot of the people who are in those classes are they work, so they have full lives outside of taking this graduate class online, and many of them have a lot of lived experiences. And so when I create the discussion questions, although they are based on the readings, it's a lot of like practical, right? Like, so they choose a health topic that they're going to like focus on for the remainder of the semester. And I'm asking them questions about their identities, their jobs, their experiences. And so I just love to learn about health topics. Some of them I've never, ever heard of before in my life. Cause it's less, some are like, yeah, diabetes, hypertension, and others are like, neurological diseases that I never considered, but this is a person who has had this issue. And so they've had this illness their whole life. And so they're very passionate about it. Conferences I've never heard of. And so I continue to kind of keep my ear to the ground just based off of what their lived experiences are and their passions are through their assignments and the discussion posts, which is super fun, super fun.
So a past guest mentioned that imposter syndrome is one of the biggest hurdles in public health careers. Have you ever experienced this, and how did you navigate it?
Yeah, I mean, I'm a Black woman, so I think that just naturally when I enter spaces, I think I've experienced imposters. Naturally, when I enter spaces, I'm like, okay, here we go. I probably experienced it the most when I was in Georgia. Because as I mentioned, like we were going, it was me and then my director was like an older Black man. And so here we were. And at the time I had this huge fro and we're like walking into this space, where in many cases, folks did not look like us, right? Like the Atlanta County is great. But once we got to the southeast areas of the state, people didn't look like us. And I struggled at times like, okay, whew, here we go. Like trying to explain to them, like, oh, we don't have trans kids here. And I'm like, how you know? I don't feel comfortable here. So I know that trans young person certainly don't feel comfortable in your school. And explaining to them kind of like what we talked about earlier, like sex ed, human growth. I would package it as human growth and development because that is what it is. And just having those conversations with those people and just kind of getting them to maybe not completely agree with me, but understand. I think I also probably experienced imposter syndrome when I first started doing trainings first started doing trainings with GCAP in the beginning, because again, I'm in a room with all health educators, some folks who've been teaching 20 plus years. And here I am like, no, instead of saying boy's penis, you need to say people with a penis. And they're like, girl, like I've been teaching for 25 years. I'm not saying people with penises. Like that's stupid. And like having to get them to understand how it can cause harm to young people in the classroom. And those were the moments when they would push back. And I'm like, what do I do here? But I probably dealt with that probably like 2-3 times. And then I'm like, all right, I'm ready for y'all. Let's go. And I think obviously the more that you do something, the more experience you have with something, the more comfort you have with it. But certainly in the beginning of training, I would say, especially post-doctorate, 2018 probably was like my hardest professional year because I was dealing with the imposter syndrome of being a doctor and this like expectation of me knowing everything, and I did not. And also navigating, convincing these very Southern Bible Belt people that this work matters. And it is life-changing for some of the young people that they may encounter.
Well, I appreciate those insights and definitely think is important, especially I feel like in nowadays to be able to find the similarities with people that are different or view things differently and kind of help them to see why what you're sharing is important and how they can pull importance from that as well. And it's a skill that I think is needed to be developed more everywhere right now, but I'll see. Yeah,
for sure.
Yeah. Okay, so moving us on to the last section of the show, the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Do it. Absolutely do it. Find your niche. And once you find your niche or even your interest, try to find people who are in that, whether it's on LinkedIn. LinkedIn is a little weird of a space, but people respond. Whether it's on LinkedIn or friends or volunteer, do it. I think the field of public health is fantastic. I think that it is going to continue to grow. And so 1000% would say do it and find your people. Find your people.
Number 2. If you were talking to someone wanting to get into your position, what advice would you give them?
Ooh, that's such a hard question. I would say it takes time and there's no right path. You don't have to take mine. You don't have to take mine. I don't know that I recommend you taking my path, but reach out to me for sure. I mean, I probably would have the same kind of candid conversations that I have with you today. If you're interested in my path, find organizations that are doing this work and I would encourage you to try to start out as a sex educator. So I did it at the high school, and then throughout my doctoral program, because I always have 11 jobs. I don't even think that's on LinkedIn. I also taught sex ed in a community-based setting. So some of that looks like through the PrEP program, personal responsibility education program. Some of that was in the schools, so we would push into the schools, and then we would also do it in a community setting. So some community centers. I think people always have respect for people who have actually done the work. It is paramount when I go into these rooms with these health teachers, and I'm able to say I taught high school health. I also taught middle school students, because I'm not telling you what I think. I'm telling you what I know, because I also have no problem saying the areas in which there were opportunities for me as an educator, because I didn't have the training that I'm now providing to you as an educator. And so I would say try to get as much experience as you can in all facets of the work that you do, because it helps your vantage point.
Number 3, what's something you're working on improving in your life right now?
Ooh, practicing what I preach. Like, I have 2 public health degrees, and for the longest time, I was not taking care of my body, right? And so we talked about movement, physical activity. Practicing what I preach, and I'm really basking in just like doing the things that bring me joy, and not doing the things that don't bring me joy. in all facets of life. And so that's what I'm going to continue to work on. I've been doing it for some time now, but continue to work on that.
Number 4, professionally, do you recommend anything?
Yeah, so I actually went and looked for this book because I didn't want to get it wrong. It's called Killing the Black Body, Race, Reproduction, and the Meaning of Liberty. It's by Dorothy Roberts. And it is a very heavy book, I will say that. So you got to kind of have your mental prepared for it. It is a heavy book, but it's a great book to kind of frame reproductive justice in this country. And so I would recommend this reading if and when you have the capacity, because like I said, it is heavy. It is heavy to consume.
Well, I appreciate that, and I will add that to my reading list.
Okay, good.
And then number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
You got this. I think that life has continued to show me that through all the ebbs and flows and all the moments of self-doubt, particularly during the doctoral program, like there are moments where you're like, yep, that's why so many people are ABD, respectfully, because you get to points where you're like, no way, I'm not doing this. I'm not finishing this. Just knowing that if I put my mind to it, I can definitely complete any task. And so just remind myself, like, girl, you got this, please. But also continue to live. I spent a lot of my 20s checking off, I'm going to be a doctor by this point. I'm going to do this. I want to get married by this. And now in my 30s, I'm like, I'm just catching vibes. Like, I'm not going back to school for nothing else. You could convince me to take a class for nothing. Maybe like a cocktail making class or a cooking class. But like, do the things, yes, have the goals, but also live and enjoy life because it's short, and spend time with your people and take the vacations and have the experiences because you don't know when you'll be able to get those. And if you're going to take out a bunch of student loans, have something to show for it. Study abroad. I studied abroad in Ghana for like 6 to 8 weeks, went to London, because you end up with these tens of thousands, for some hundreds of thousands of student loans. And it's like, you don't even have experiences other than this literal piece of paper to show for it. Study abroad, do the things, do all the things.
It's a great way to end the interview. Thank you so much, Dr. Daniella Thorne, for coming on and sharing your insights.
Yes, thank you. This has been great. I really appreciate you having me.
Yes, it has been fun indeed. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not subscribed as yet. Leave a like, leave a review, 5-star review would be very helpful and thankful. And share this with a friend who gets some value from it as well. Appreciate you all tuning in, and I will see you all next week. Peace, everyone.